Hi, welcome back. We're talking about the brain today. We're talking about what does a healthy brain need. And so there's basically just four things we'll focus on today. The brain needs fuel. And fuel is its glucose supply and its oxygen supply. So obviously, if you've got glucose problems or you've got autonomic nervous system problems affecting your blood supply or blood flow, or if you've got an anemia or something like that, you're going to have some brain-based problems because you're not getting enough fuel to the brain, glucose and oxygen. The other thing the brain needs is neurotransmitters. Neurotransmitters are the chemicals that allow the signals of the brain to go from one neuron to the other neuron. So this is called a synapse in between them. And a chemical messenger called a neurotransmitter takes the signal from one neuron to the next. You must have the proper levels of neurotransmitters to have good brain function. The other thing is you're going to need activation. The brain must be stimulated. Anything in the brain that is not used, you lose. Okay, so this we'll get to in just a moment a little bit more. And lastly, it needs an inflammation-free environment. Inflammation always slows down the brain. It always causes the brain to degenerate more rapidly. So anything that's causing inflammation is going to be a major issue for the brain. So let's go back to the activation and let's look at how a normal brain functions. So what happens when I move my arm out here like this? Well, there are signals that enter into the brain from the cerebellum that, and this is all signals from the body with the exception of smell and vision. And they enter into the cerebellum and then they fire across to the opposite brain or opposite cortex, and then the cortex sends a signal down to the lower brainstem. This is the operation of a normal, healthy brain. And why does this occur? Well, it occurs for activities to happen like what we're talking about, movement or something or thought, but it also occurs for inhibition. And so one of the things that the lower brainstem does is it inhibits the midbrain or the mesencephalon. The mesencephalon is your sympathetic nervous system. You probably remember sympathetic nervous system meaning fight or flight. It's your emergency system for getting you out of a dangerous situation. So you don't want this going on all the time. So the brain actually inhibits this to keep it in check until it's needed. Well, that's great if the brain's working great. But what happens if you lose signals into the cerebellum? Then you don't get signals up to the opposite cortex, and you decrease signals to the lower brainstem. What this happens, or what this causes, is an overfiring midbrain or mesencephalon. That means your sympathetic system is now upregulated and it's beginning to affect the function of your body. So why is that a problem? Well, when you have an overfiring mesencephalon, you're going to have blood flow that shunts away from the brain and organs to the muscles of the body for a fight or flight situation. So therefore, you're going to end up with a variety of different types of symptoms. For instance, you're going to end up maybe with migraine headaches because you're getting less blood flow to your brain. You may also end up with a racing heart because your heart rate is going to go up when you're sympathetic. That's intelligent, that's smart, that's needed. Constipation and diarrhea may happen because you're going to have less blood flow and less nerve supply to the gut. Chronic fatigue and fibromyalgia, you always have more pain with an overfiring sympathetic. You may have urinary tract infections because it doesn't empty properly. And you may have sleep problems, of course, and fatigue because you've got a dysregulated adrenal function. And then light sensitivity because when you're in sympathetic, you have dilation of the pupils. And here's the problem. Most of the time, we've been taught to treat these different symptoms with drugs. However, what are drugs going to do about decreasing this mesencephalon? Nothing. So you just end up with a lot of drugs to cover symptoms, but you still got the same problem going on and on and on and getting worse. So what's the secret is to get the brain firing again, because the brain will then inhibit the mesencephalon properly and you got your best health. God bless and have a great day.